All right, guys, thank you so much for coming back to the channel. I'm really excited about today's guest. We've got Dr. Jamie Seeman, who is, I'm sure if you watch my channel or listen to my podcast, you know exactly who she is, but the current Mrs. Nebraska. And we're all going to be rooting for her to be Mrs. America very, very soon, like in the next, couple of month or so that you're going to be going to that. Yeah,
Yeah.
exciting.
Yeah. I leave in 18 days.
Wow.
18 days.
Yes, everybody in the community is going to be rooting big time for you to take the crown. So thank you for taking the time out today to talk with me. I really appreciate it.
Absolutely. It's my pleasure. We're spreading the message.
Yeah, absolutely. So we talked a little bit off camera before we got, well, you know what, before I jump into everything, if you wouldn't mind going and giving everyone a little bit of your backstory with insulin resistance. I mean, I'm sure a lot of people already know, but insulin resistance and just being a doctor and having to go through that and then reversing that and getting your A1C down briefly.
Yeah, absolutely. Because it's really an important part of why I do what I do. So I was born, pretty athletic, grew up as a three-sport athlete, went to college and played college athletics, met my husband in college. My undergraduate degree is in nutrition and exercise science. So I've always had an interest in that world, which is a little bit different than many of my colleagues. But my husband and I got married, and I went to medical school where I had three children in the middle of my training. And the real message here is that doctors are just as human as their patients are. So, here I am, this highly educated person. I have a medical degree, I have a nutrition degree, and I was just as confused as everybody else. And I really kind of fell into the world of convenience, of foods that were fast, cheap, that tasted good, that I thought were not that bad for me, right? They were low fat, they were heart healthy, they had all the words on the boxes. But here I was as an adult living with prediabetes and hypothyroidism, and I didn't know it really for many years. I kind of
Mm.
navigated through my pregnancies with kind of, so nutrition, a little bit of exercise here and there. And I just thought the way I felt was how life was when you were a busy mom of three and you had a husband that worked nights and weekends. But I was tired. I mean, I couldn't stay up past, a minute past my own children's bedtime. I had constipation. I just didn't feel good. I
Mm.
had acne and rosacea, just very mild symptoms. But if anybody were to look at a picture of me, I don't think anybody would have said, "Oh my gosh, that woman definitely is on the 5-year plan for diabetes." But
Yep.
I got my labs checked, and thank God I did. In 2015, I had a really horrible tragedy happen in my life. I lost one of my best friends, and it was just kind of this life moment that really catapulted me into living my life differently. I just kind of felt like fraud as a physician. Here I was supposed to be the billboard of reducing cardiovascular risk and diabetes, and how could I expect my patients to do anything I wasn't willing to do for myself? And at that time, keto wasn't really like a hot thing. I really started to navigate into the nutrition literature and start questioning things that I had learned. And gosh, we never learned about this in medicine. And all I can find in the interwebs is how bad it is for you. So I really just kind of became an N of one experiment. And I started with Whole30 and then paleo and then keto. And now I'm kind of carnivore and somewhere in between. And I've tried all these things. And I've really kind of become my own expert at my own body, which I think everybody should do. And
Yes.
we're going to definitely dive into that, because what works
Yes.
for me and what works for you and what works for everybody listening is not the same thing. Um, but what's incredible to me is what started as just changing my diet, literally changed everything in my entire life. It changed the way I practice medicine. It changed the way that I am as a mother now. I have more energy. It just changed my entire zest for life. I started going after things I never would have had the energy or the desire to even pursue, had I, continued to feel the way that I felt back then. So it's just been a whole transformation. And now I'm really just trying to change other people's lives, because it's never too late. And I've seen it in my own patients. And that's why I'm here. That's why we're here on a Sunday recording this podcast, because
Yeah.
literally, I can change so many more lives by the people listening right now than I can, I can only see so many patients in a day.
Yeah, exactly. And I mean, I love that you do a ketogenic therapy with your patients also because, right now there's just this fertility epidemic going on. I have so many friends and, I'm a yoga teacher. I've been teaching yoga for over a decade now. And a lot of the yoga people are vegans and vegetarians, and they eat a very high carb plant-based diet. And I feel like a lot of my yoga teacher friends are on a fertility journey right now, big time. And it's so hard for me to sit where I'm sitting and know what I know and just say, if you would perhaps cut some of that out and add a little more animal protein and some egg yolks and some meat into your life, this might not be such an issue for you. So is that something that you see a lot in your practice as well?
Yeah, we've definitely seen that nutrition is a political game.
Yeah.
When it comes to US dietary recommendations and the new guidelines that came out this year, there is a lot of politics at play. And it's really what got us into this mess. If we kind of backtrack in history, how did we end up here? Well, certainly, modern civilization, has allowed us to have shelf stable foods and things like that. But, food manufacturers are only going to make food that people buy. And so they have created these, foods in labs that are just delicious and
Yeah.
they taste wonderful. I won't lie. A package of Oreos is dang delicious. But what they do is they override our satiety mechanisms, and they're addictive and they're inflammatory, but they're cheap and they're convenient. And when we look at, let's look at, keto versus vegetarian versus carnivore versus paleo versus whole 30, right? I think the one thing that maybe everybody can agree on is that eating a whole food diet is
Hmm.
probably a good place to start, right? Anything that had a mother or grew in the ground. That's what I tell my patients. It's just,
Yep.
you don't want to overthink it, but there's certainly so much politics involved. And what I'm seeing right now in 2021 is that, there really is this quote unquote plant-based movement.
Hmm.
And the harmful thing that's going to come of this is that when we look over the last 30 years, we're eating less meat than we were in 1980s. And the rates of cancer and obesity and diabetes and heart disease have all gone up. So you can't say that it's the red meat. And just this last week, I had to sit in a cardiology appointment with one of my family members and listen to this
Wow.
cardiologist talk about how beef and saturated fat were going to drive this person's heart disease. And,
Mm-mm.
I could pull a lot of 2020 and 2021 studies, I mean, very recent studies, that show that that's just not true. But it's hard. It's hard to look your friends in the face and your family members in the face because people are very defensive about
Yeah.
it. Um, and social media has really just become an echo chamber for a lot of those opinions. And so I encourage people to explore all the options. And there are people that could eat a vegetarian or plant-based diet and be healthy. That is totally fine. I'm not here to tell anybody what to do, but from my standpoint, what are your numbers? Do you have normal
Hmm.
body composition? Do you have normal metabolic markers? Are you functioning optimally? Are you giving the world what it deserves? And, if the answer isn't yes to all those things, then maybe something needs changed. And fertility, yeah, let's roll back to your original question.
Yeah.
It's becoming a huge issue. There's increasing infertility not only for women but for men. Semen
Yes.
analysis, I go over these with couples. There's just as much bad sperm as there are, bad ovaries right now. And nutrition plays an integral role. And I tell women, your body has these nutrient sensing pathways that are directly correlated to your circadian rhythm and your fertility. And all of these things matter, not just nutrition, but stress and the way we sleep and the amount
Yes.
of sunlight we get. It all matters. And you got to pick a place to start. And I really honestly believe that if you only could focus on one to begin with, nutrition is really where it's at.
I agree. And it's, more than just fertility. I see so many women, they hit their mid 30s and they start having that lower progesterone and they start slipping into estrogen dominance, which I know a lot of people in my audience, we've been taught to fear estrogen because of this whole estrogen dominance thing. I know it's not a totally bad hormone, but I got into it big time when I hit my mid 30s, and I was like, the shape of my body changed. And all of a sudden, I got insulin resistance. My A1C got to be really high. And I was like, my doctor was like, oh, we're not really worried about this. I think I was like a 5.8 A1C. And she's like, oh, no, we don't need to really worry about that. So that's no big deal. And I was like, well, I have this weight that I can't lose. And I had cysts on my ovaries, and it was just like this big shift. And I think that when we change our diet also and look at some lifestyle things, that can also help with those women who are struggling with estrogen dominance as well.
Absolutely. Each decade of a woman's life brings different, struggles. And so, what happens, I have three little girls, so very near and dear to my heart, but eventually here they're going to go through puberty, right? Where they start
Yeah.
having their menstrual cycles. And women are born, our ovaries were born with all the follicles, all the eggs we'll ever have in our entire lifetime. It's pretty fascinating. And there's about 1 to 2 million at birth, and then about 400,000 left when a girl enters puberty. We only
Wow.
ovulate about 400 to 500 of those eggs. And so once that clock has started ticking, there's only so many left. And every single month, the brain in the pituitary gland, it stimulates the ovary and it says, hey, 15 of you, get ready. I'm going to pick one of you. And so every single month, a bunch of follicles get stimulated, and then one becomes the dominant follicle, and it ovulates. And so obviously, if you don't achieve a pregnancy, and nobody wants a pregnancy every single month,
Right.
then those follicles are gone. I mean, they've left the party. And so what happens as we get into our 30s is, in our 20s, we can get away with a lot of bad behavior.
Oh
Our
God.
bodies
Yeah.
still are, we don't have cellular senescence, which means kind of like lazy cells. Like, I mean, we can kind of abuse our body. Everybody went to college,
Mhm.
right? And you can still kind of bounce back. But as you get into your 30s, your ability to recover from poor nutrition, lack of sleep, excessive alcohol intake, it starts to suffer. And as we enter our 40s, then we're getting closer to this perimenopausal stage. And
Mhm.
perimenopause is when we've really depleted the amount of follicles left in our eggs, eggs left in our ovaries. And so, each month the pituitary gland's like, hey, 15 of you get ready. And they're like, well, there's only 3 of us that are even close to ready. And so eventually what will happen is those little follicles are making estrogen, but they don't make progesterone until they ovulate. And so this
Mm.
idea that you brought up of this kind of estrogen dominance is that the closer we get to menopause, we naturally become more estrogen dominant. And then once we go through menopause, we're kind of in this permanent state of very like mild estrogen dominance. And we can talk about that kind of physiologic shift that happens after menopause. But in this transition, women that take care of themselves tend to have very few complaints. And I think a lot of women come to my clinic thinking that my hormones are messed up. That's why I feel this way. When really a lot of it is that we've messed up our hormones
Mm.
because
Yeah.
sleep and nutrition and exercise and stress and environmental toxins are really what kind of regulate those things. And so everybody's body is a little bit different. And hormone testing is very hard. A lot of women will listen to this podcast and they're going to run off to their doctor and say, well, check my hormones. But it's like,
Yeah, I've done
it's like a
that.
moving duck because every single
Yeah.
month, every day of the month, I could check them Monday, Tuesday, Wednesday, Thursday, Friday. They're going to be different depending
Mhm.
where you're at in your cycle. So I do, advanced testing like Dutch cycle mapping and things
Mm.
like that if we're really trying to get down into the weeds. But a lot of the times you don't even really have to check them. A patient will describe their symptoms and I can almost always tell you exactly what's going on. But estrogen dominance essentially can give you a variety of clinical symptoms, things like breast tenderness, fibroids, uh, you know, poor recovery. There's lots of different things. PCOS is an estrogen dominant state, like you were kind of describing, but um, estrogen is a great hormone. It's a great hormone
Yes.
for women. And there's a darn good reason we want it. Even after menopause, there's good reasons for hormone replacement therapy, but we want it in the right amount, and we want to be able to metabolize it and get rid of it. And a lot of the lifestyle things that I've kind of touched on are things that can inhibit that from happening.
Yeah, that I love that heard you talk about this on other podcasts before, just things in our environment that can create more estrogen that our body just literally can't detox, like the receipt papers
Yeah.
and using plastic. I didn't know that about the receipt papers. And then people are using the hand sanitizer with the receipt papers and kind of like making the whole thing worse. What are some some things like if there was someone listening, what they could do to cut down on those xenoestrogens, the ones in the environment.
Yeah, yeah. So there's really, when we think about why would a woman have a ton of estrogen? Well, that could just be her. Some women just make a
Right.
ton of estrogen, right? But this environmental xenoestrogen exposure is essentially um, chemicals and you touched on receipt paper. That's a huge one that people never hear of. And if you use hand sanitizer, it increases the absorption of it tenfold. And of course, plastic water bottles, plastic food
Hmm.
containers. You never should heat your food. It's okay to store them in a plastic container in the fridge, but don't ever heat them. Don't put them in the microwave.
Yes.
Put them in a glass dish or a glass plate or something like that. Or you can totally switch to glass and stainless steel, serverware and things like that. The paper that they wrap your meat in at the meat market, yeah, that's
Mm.
fine. Bring it home from the market and, unwrap it and put it in a different container. And once again, never heat it in there. But other things to consider are cosmetics,
Hmm.
fragrance, anything with fragrance, the wall plugins, the car air fresheners, perfumes,
Yeah.
scented body lotions. A lot of these things can just have very odd chemicals that can be chemical disruptors and xenoestrogens. And then the other ones that really women need to hear about is unfortunately alcohol drives excessive amounts of estrogen. It increases the aromatization, which is a fancy word for saying there's an enzyme that converts your testosterone into estrogen. And this is both men and women. So men, this is where men get man boobs if you drink too much beer. So
Yeah.
alcohol use, just obesity in general increases aromatization. And then just other inflammation in the body, anything that drives inflammation, that's such a buzzword right now. And then insulin resistance. Insulin
Yes.
resistance drives aromatization. So you take a woman who's 40 years old and obese and insulin resistant and drinking a bunch of wine at night,
Oof.
and that's just a perfect storm. And there's a
Yeah.
lot of women that will resonate with what I just said.
Yeah, absolutely. And I'm so glad I don't drink anymore. It's something I took out a long time ago because it's a nice way when you're stressed out to just unwind. And it can be, I had to stop because it was something I wanted to basically do all the time. And I was like, you know what? This is just one of those things, kind of like the way that I eat. I don't eat sugars and things like that because it just is like there's one is not enough and it's too many. And then to hear about this effect that it has on the body also is more motivation to kind of keep that off the table for sure.
Yeah, the tough part about alcohol is that, people will say, oh, but there's these studies. If you have 1 to 2 glasses of, red wine, it's good for your heart. But the problem is that, the alcohol in it of itself, it's inflammatory to the body. And this idea of oxidative priority, right? Nobody drinks 2 glasses of wine and doesn't eat, right? They're like,
Right.
slamming into the charcuterie board or eating dinner or going for the sweets. And so, if you drink alcohol, your body has to burn through all of that alcohol before it touches any amount of food you've eaten. So, really, a more strategic way to drink, if people want to know, listen to some of the biohackers and things, is that you should take some vitamin C and glutathione or some liver before you drink, and you shouldn't eat for several hours really. And in a ketogenic state, you get intoxicated much quicker. So I'm a cheap date. I can have 1 glass of wine and that's it. So, but really, honestly, I mean, if you can avoid it, just avoid it. And my husband and I will have one on occasion, but it is very much social and for only that purpose.
Yeah, absolutely. Absolutely. So I wanted to talk a little bit about, I heard you talk on another podcast about your thoughts on intuitive eating for women and just how our cycle and how for the women who do cycle who are listening, how it gonna we go through these shifts. And I keep hearing different things about, the first half of your cycle is when you should have carbs if you're going to have them, or some people are saying the second half of the cycle is when you should have them. And I loved your little, I think you were like, women can't really do a lot of intuitive eating, especially in that second half of their cycle. So if we could kind of drill into that a little bit.
Yeah, I mean, intuitive eating sounds kind of like this magical fairy tale. The unfortunate part is intuitive eating got a lot of people listening into the exact situation they're in, and that was including myself.
Yeah.
And the problem is that if you're sick and broken metabolically, your satiety mechanisms are not normal. And so it's hard to say, well, just eat intuitively, because you can't really do that until you are at kind of your goal, your whatever it is, whatever that goal is of like function and optimal life. Like you can't really like dive into intuitive eating until you're there. And
Balance
so
blood sugar, right? Would you say?
yeah. And so,
Yeah.
blood sugar dysregulation, just the inflammation, your satiety mechanisms change as you lose or gain body fat. So, I mean, as you
Mhm.
diet and are trying to drop body fat, your body will fight you tooth and nail. I mean, that is a protective survival mechanism of humans, is that it's easy for us to store energy, but your body it won't just throw the energy out the window. It's
Mhm.
designed for storage purposes, because a long winter might be coming and we don't know if food will be available. I mean, that's where our ancestors came from. And it's, from a fertility perspective, I always remind women, like, your body is such this fertile creature that it's always trying to sense, is this a good time to reproduce? And it's always trying to protect you from harming your reproduction, although we've shown that that's darn easy to
Yeah.
override. But,
Yeah.
but in a menstruating woman, the reason it's difficult is because every single week, remember when I said it's hard to test hormones? It's because every single day, every single week, these hormones are fluctuating. So at the beginning of the cycle, so let's say cycle day 1, that's the first day of bleeding, the first day of heavy flow of bleeding. This is when you're starting to see an increase in estrogen, okay? And you have high insulin sensitivity. So you're quite insulin sensitive during this time. So during your period, if you want to have some complex carbs, some rice, some quinoa, some sweet potatoes, I got no issue with that. Your fuel source at rest is glucose. And during exercise, it's fat oxidation. Your fat storage is lowered, so you're not really, storing a lot of fat. You've got a normal metabolic rate. Your hunger is usually lower, which is funny because I
Mhm.
think most people are like, oh, it's my period. Like, that was last week, honey.
It's the week before. Yeah. Exactly. It's the week
um,
before is hell, but the week of, I'm like always
yeah,
relieved when it's
yeah.
that week, because
So
I'm like,
water
finally, I'm
retention,
not gonna.
water retention, kind of that bloating feeling, that's low. And it's a great time to grow muscle. Okay. So, that week, as long as you're not having super heavy bleeding and cramping, which is funny because, like, now with my new lifestyle, I don't even feel my periods. It's like the most
No,
incredible thing ever. But then as you
agree.
transition into week 2, okay, so day 7 to 14, now estrogen's coming up, even higher, and we're about to ovulate. And so as soon as we're about to ovulate, there's kind of this little burst of testosterone that happens, and we do see just a small amount of increase in water retention. And then after ovulation, this is when progesterone is coming out of that little, remember I said that little follicle comes to the party, and then after it ovulates, it makes progesterone because it's anticipating a possible pregnancy. Progesterone is a hormone of pregnancy.
Mhm.
And I made a great Instagram post about
I
being
saw that.
progesterone drunk, because I've tested myself and I make like enough progesterone for like 5 babies. So, but what happens is in this progesterone phase, insulin sensitivity is very low. So if we were to
Mhm.
put a continuous glucose monitor on people, we see more blood sugar dysregulation. They have baseline fat oxidation, and even more fat oxidation during exercise. They're not even like doing well at burning carbs. This is the body's, mechanism here for reproduction. But there's increased fat storage. There is an increased metabolic rate. Maybe women have
Mhm.
noticed they feel kind of hot or even sweaty at night during progesterone phase, or people have I know people have seen it on their
The
aura
Aura
ring.
ring.
It's so
Yep.
cool, right?
Yeah.
You can see that basal body temperature is rising, but hunger is off the charts because the body's anticipating that you might get pregnant this cycle and it
Mm.
wants you to eat. Remember, I said the body wants you to survive. It wants you to perpetuate your DNA until the end of time. Water retention kind of lowers a little bit during this time, and muscle growth is not good during this time.
Mm-mm.
You do not recover well from exercise, like HIIT training. That would not be a good idea. So in this early luteal phase, so like day 14 to 21, maybe just some low intensity exercise. And, and when we say be intuitive, I mean, just understand that this is normal physiology. And depending on what your goals are, you might have to kind of hack the system. Like right now, I'm trying to lose body fat. So I'm having to do things that help with that satiety and that hunger. And then as you get into that week before the period, it gets even a little bit worse, because
Yeah.
now we're seeing water retention. You're hungry, your blood sugars are all over the place. You just feel bloated and horrible, and you're just begging for your period to begin again.
Yes.
And yeah, unless you get a positive pregnancy test, in which case you're going to feel that way for another 40 weeks.
Right. Exactly.
Yeah. Yeah. So that's,
Yeah.
I mean, don't hate your body. I mean, these are
Yeah.
normal physiologic changes that are happening. And I think the more you kind of get in tune with them, if you're off any sort of like hormonal birth control, you can track your cycle. And it's very easy for me. I'm like, oh, I think today is day 14, or I mean, I can
Yep.
always guess what day I am because I, just based on how I feel.
Yeah, and that's one thing I love about what you're doing in your whole platform and your whole message is you're really working to empower women, where we've been taught so incorrectly that our bodies are bad and that periods are bad and the cycle is bad and oh, you're emotional and be dainty and be skinny and you want to be a lightweight and all this stuff and your whole message is like completely contra that and I just love it and promote it and I want women to not fear their cycle and to see that as like their fifth vital sign, as you've said so many times before. Like if your cycle is not regulated, then there's something going on that you need to take a look at.
Yeah. Yeah. On both ends of the spectrum, when kind of carnivore became this hot thing, I don't think zero carb is for every woman.
Yeah, I
I think
agree.
I consulted with a lot of people in the carnivore space that they didn't lose their period on carnivore, but they had like, never
Well,
had a
I
period.
did.
Or yeah, I mean, yeah, and I watched my estrogen go down when I was carnivore, and part of it was that I got very lean. But zero carb is not for everybody, and ketosis isn't for everybody, especially long term. And I think that everybody has to find kind of that place where their body is functioning optimally. You
Yeah,
feel good, you like the way you look, all those things. But we also have to match reality, because in the social media world, we're sold a finished product all the
yeah,
time, right? This like super ripped guy and ripped girl, or skinny, or a model, and she's got big breasts and all this, and we're sold this image, and the extreme things that some of those people have to do to look that way, that's not
yeah,
sustainable, and that's not for all of us. And so we're such a finished product society where we really need to embrace kind of the process. This is a
yeah.
lifestyle change. This is changing the way you think, eat, move, all the things. And that's what's going to get you in a sustainable lifestyle.
Yeah. And, I think that we're so trapped into these one approach is going to fix everything. And I fell into that with the carnivore diet is like, I had so many great improvements right away, immediately, just amazing improvements. And then I started my YouTube and I started my platform and people started following me. And about a year in, I started having trouble and I was like, oh crap. um I have to look at this objectively. I have to have an open mind about it. And so I've been really open with my audience about a lot of the changes I've had to make. And you know a diet is great, but it's a tool. And the trap that I feel like a lot of us have fallen into is looking at the carnivore diet's going to fix everything, or keto is going to fix everything, and then they're not. One thing I keep hearing is like, oh, if you eat a lot of meat, you don't have to lift as much weight, so you don't have to work out as much. And I'm like, oh God, that's not really a good
Not
message to
quite.
be
You still have to
promoting.
be able to hunt.
Yeah, it can be dangerous that, we just look to these one, and I have a podcast. I talk to people about minerals and like, oh, your whole problem is minerals, or your whole problem is your gut. And it's just like we
Yeah.
can't look at things as a whole, and that can be
Yeah.
so dangerous.
Yeah, it's very myopic to kind of look at some of these things. And back to this meeting with this cardiologist, it was like this person was so honed in on the fact that if they could just get this patient's LDL less than 70, that's what's going to prevent a cardiac event. And it's so myopic. You have to look at everything. You have to look at the
Yeah.
big picture. How's the patient sleeping? What's their stress level like? It's just, and that's, I think, social media, like I said, kind of perpetuates that echo chamber a little bit, that it's like, oh, it's your gut bacteria. Oh no, it's this. Oh no, it's that. Oh, it's your
Yep.
it's your manganese. It's your
Yep.
and it's it's making it very confusing for people.
Yeah.
And they're sold a bunch of supplements and this and that, and sometimes we just need to dial it back a little bit,
Yeah.
and and kind of look at the 3,500-foot view.
Yeah, definitely. Speaking of, I guess, kind of diet variation, I've talked to different people. I've talked to Dr. Mindy Pels. I don't know if you know her. She's all about fasting. And I've talked to a few other people, and they're very much on the camp of like the week before your cycle, that's when you have your carbs, and you should go hard on, keto or your fasting or whatever in the first 10 days of your cycle, maybe take a break during ovulation, and then the last days before your cycle, then you have your carbs. But do you feel like that's a good plan, or does it kind of have to be individualized?
Yeah, I mean, it certainly has to be individualized. I don't change my eating pattern based on, where I'm at in my cycle. I just don't. I think it's too confusing, for
Yeah.
patients as well. I mean, and a lot of them for me are on, some sort of contraception anyway, and we're not really tracking cycles. So I just think that's a confusing way to try to teach people. I mean,
Yeah.
I, I have trouble teaching people what a carb, a fat, and a protein are, let alone when to eat what and how much and, whatever. Like, we have to make this simple.
Yeah.
Like I had just right before I got on this podcast, somebody messaged me, okay, I think I'm going to try the ketogenic diet, but I'm so overwhelmed and I don't know where to start.
Mm,
It really shouldn't be that overwhelming. We've made it
yeah.
so complex.
Yeah, I agree.
Yeah. So, I mean, like I said, be your own expert. I don't know, add some complex carbs in. How do you feel? Did it make you,
Right.
feel better? Is it getting you closer or further away from where you want to be? Be your own expert, because we all respond a little bit differently. But I don't change my diet based on where I'm at in my cycle. But certainly in the first half of my cycle is where I could tolerate more carbs, go harder in the gym. Second half of my cycle, I got to dial it back a little bit.
Yeah, I agree. And for me, if I was to do carb cycling or try that out, I feel like I have such a history with like addiction and sugar addiction, food addiction. And I've talked to a lot of people that are like this, that they have a little bit of rice or they have a little bit of that carb, and it just sends them into a spiral. And I'm like, that's the last thing I want for people who have worked so hard to get where they are and get into this lifestyle, that they go and they're like, I'm in a carb cycle this week, and it just totally sends them off.
Yeah, I do agree with that. And on that same note, because you mentioned fasting, I think the fasting
Yeah.
card has been overplayed a lot at the poker table recently.
Oh, yeah.
It's a tool.
Yeah,
And
that's
I don't think,
probably why I lost my cycle was
yeah,
yeah.
yeah. And I don't think everybody should do it. And I don't think everybody should do it all the time. Uh, if your goal as a woman, because my, message to people is like, build lean body mass, right? And at the level that I train and at my current body fat, I should not be fasting. I just shouldn't. And I
No.
think it's
No.
okay. I think it's okay to do, maybe like a 24, 48, maybe a 72-hour fast a couple times a year or something like that. But I
Yes.
see people get into this, like, I'm like, it's like a badge of honor. Like, I've been fasting for 60 hours. And the problem is that,
Yeah.
you may start to lose lean body mass. And I really see women in particular, back to this idea of intuitive eating. I've seen intermittent fasting push women into binge and restrict behavior. It's like they
Yes.
fast, and then all of a sudden when they start eating, like, they can't stop. Like, whenever they've opened their eating window for the day, like, they're consuming a boatload of calories, and you can still do that in a short window. And you kind of brought up that idea with the carbs, and I do feel that way as a former, I'll be an admitted carb addict myself.
Yeah.
As soon as I start, let's say I open a box of almond crackers or something like that, they're like low
Oh
carb.
Lord.
I can't stop. Like,
Yeah.
I can't be trusted with the box. I totally agree with that. And I think part of it is that kind of the mental health aspect of,
Hmm.
and I see people in the keto space, a lot of them came from disordered eating, whether it was like binge behavior or anorexia or bulimia. I mean, I've seen a lot of people in this space that had former eating disorders, and that's, it is a big issue. And I don't think there's such a stigma associated with it. And I wish people talked about it more, transparently, because I have eaten in my pantry, like I mean, I have like made sure my husband was gone. Like I have been there before where you're like,
Yeah.
no one will see this. No one will know I'm
Yes.
doing this. Like that is messed up. And
Yep.
that like, and there's people in the space probably doing it and they're not
Yes.
putting it on their social media because they want people to think they live this finished product fairy tale world. And no one does, trust me. No
No,
one does.
no, no.
No.
Yeah, people know that when they follow me, they know it can be messy at times, and I
Yeah.
typically will tell people what's going on. And I feel like you can't really trust the people who are perfect all the time and don't ever have a problem. And I was able to do this and feel great. But going back to, I guess, the fasting and the variation, I do see women, and I experienced myself, lowered progesterone doing carnivore all the time. And for me, the trick was, and it won't work for everybody, I had to go super high in fat. And the week before my cycle, that's the only way that I would not go and binge was like, I just have to make sure I eat like a ridiculous amount of fat if
Mhm.
I want to stay on this way of eating. So for women that, that you see that do keto or do carnivore, low carb eating, that are starting to see a decline in those hormones, and it's not necessarily correlated to, perimenopause, getting older. It's just like that's directly correlated to the diet. What kind of advice or program would you give them?
Yeah. Yeah. I mean, so what happens like, in your situation, it is when somebody goes carnivore, it's easy to eat a ton of protein, right? And when we
Yeah,
look at, what ketosis really is, it's like 20% protein. And,
right.
when you start just eating ribeyes and chicken and all this, you're eating tons of protein. And it's hard to add the right ratio of fat and protein in there. I'm struggling with
Mhm.
that right now, like currently, like right now with my coach. Robert Sykes is coaching me in
I
this Mrs.
love
America
him so
prep.
much.
And I'm literally like taking MCT like oil by the tablespoon. And he's like,
Yeah.
less protein, less protein. And I'm like, I'm so used to eating high protein. It's hard. But our sex hormones, estrogen, progesterone, testosterone, they're made from cholesterol, right? So you'd think this diet full of this great animal cholesterol, right, would just like pump out all these hormones. But it's not true when you're eating a ton of protein and you're not getting that fat in there. That's basically what we call a protein sparing modified fast,
Yep.
where you don't restrict protein, but the energy calories, fat, and carbs are super low. And for women, that can be very detrimental. I think men can get away with it pretty easy,
Yeah.
but women really can't. We're reproductive creatures. And you got to kind of listen to your body a little bit in that situation. And I think where carnivore works is for people with autoimmune conditions. I mean, I've
Mhm.
had patients have great success with it, but I always tell them the goal is let's go carnivore for 14, 21 days, whatever it is. And then let's start adding a few things back in and see how you feel, see how your body kind of responds to those things. And you'll find certain plants or vegetables that you tolerate just fine.
Mhm.
Because the gut microbiome changes in about 10 to 14 days. It's rather rapid, and so you're going to know rather quickly if somebody is, responding well to it or not.
Yeah. Yeah, I think the danger, again, kind of what I said earlier, is that we start feeling really good and we feel like, okay, this worked for 30 days. I need to keep doing it. And you do it for a year. And then, you don't have a cycle anymore. And you're like, well, maybe this isn't working out. And this
Yeah.
isn't, you stay in that kind of gluconeogenic state all the time,
Yeah.
not really in
The
ketosis or.
body, the body is so adaptive. And so my diet's never the same. I mean, I'm always changing things. And you bring up this word cycle, right? It's like, think of it like we have seasons, we have life cycles, we have like everything is a cycle. And so I think it's good to like, you know, be in ketosis in the winter and then in the summer have more berries and squash and whatever. And then, oh, you want to do 2 weeks of carnivore? Great, do 2 weeks of carnivore and then go back to paleo. I mean, I think it's always good to change things up and kind of find your rhythm. And, we naturally kind of find that rhythm around social events and things like that. I mean, I think you still have to live your life and make memories and you just got to figure out what works best for you.
Yeah, I think the message is stay with the whole foods, real foods. Like you
Exactly.
said in the very beginning, if it doesn't come from the ground or have a mother, then don't eat it. And we have to stop being so dogmatic, especially when we start, getting those test results back or we stop feeling our best. We don't have energy. I have so many women that are in my private group that are like day one, I'm like, what are you guys struggling with the most? And they're all like, we're not sleeping. I mean, just the not sleeping. I'm like, well, are you, and half of them were doing OMAD and had been doing OMAD for
Yes.
months and months. And I'm like, why?
Yeah. Yeah. And you brought up progesterone. Progesterone is a great hormone for sleep. It will really help you sleep
Yes.
well. And there's a place for hormone replacement therapy. You know, I don't know how old some of these women are, but there really is truly a place. And I think in kind of the keto carnivore world, people are so like anti-medicine. And it's
Yes.
hard for me because like I walk this fine line of I tell people I'm, you know, boarded in integrative medicine and immediately I'm a quack. And then, you know, on the other flip side of it, like I'm board certified in Western medicine and I'm immediately evil. So I'm always trying to like walk on both sides of the fence. And hormone replacement therapy isn't like, it's not like statins. It's not like these other, you know, Western medicines. It's
Yeah.
literally, you know, you really should think of it more as like it's like biohacking. It's a
Yeah.
recovery modality. Um it's in a different world, and so people shouldn't be afraid of it if you're a good candidate. But yes, sleep is a huge one, so important, and it's a very underutilized tool in people's toolboxes.
Yeah, I agree. So, I mean, just don't be so, again, dogmatic about we can't do medications. We can't do this because it's Western medicine. I think that's another danger of like this, carnivore keto echo chamber that that's going on. So we're glad that you're in the space to kind of give a well-rounded view of what could actually help someone, because that's what we're looking for at the end of the day.
Yeah, absolutely.
Yeah. Well, one other thing I wanted to ask you about was thyroid, because there are so many people that do keto, do carnivore, and they see their TSH stays normal, their T4 stays normal, but then their T3 gets lowered. And I wondered if you could talk a little bit about that for people.
Yeah. So thyroid in general, 5 times more common to have a disorder in a woman versus a man, right?
Wow.
Women are so complex. And like I said, your body is women, you are a reproductive creature. So I don't care what you change, your sleep, your stress, your diet, it will affect your thyroid. All of it will.
Mhm. Yeah.
And estrogen increases thyroid binding globulin. And so if you're estrogen dominant, it's actually increasing your thyroid binding globulin, and it binds up your free T4 and your free T3. And so um, that's one thing. So excessive estrogen, lower thyroid function. Now you asked specifically about women in the keto carnivore world that have a lower free T3. Well, anytime people go on a calorie restrictive diet, we will see a decrease in thyroid function. Okay. The TSH might go up, the thyroid levels will go down, and this is the body's protective mechanism. It says, okay, I'm seeing that there's less food coming in, so
Mhm.
I'm going to start to conserve energy in case the food stops coming in. So any calorie restrictive diet, I don't care if you're on a Twinkie diet or whatever it is, calorie restrictive diets across the board will lower thyroid function. Okay, so let's say somebody is on a eucaloric diet, right? They're maintaining their body weight, they're at a calorie level to maintain their body weight, but they're keto, and the free T3 is low. And I have seen this in women in carnivore. They don't seem to be symptomatic, right? So
Right.
they don't come,
Exactly.
they come in and ask to get their labs checked, but they don't come in complaining of hypothyroidism symptoms. So then we look at the data, and who's done studies on this? Well, Jeff Volek has done some studies where he's followed people's thyroid function and ketosis, and we do see a reduction in free T3 levels. Now, whether that's some sort of, physiologic protection, or whether that's an increase in thyroid sensitivity, we don't really
Mm.
know. And I'm, maybe argue for the latter, but I just don't have the science, to back it. But kind of like you improve your insulin sensitivity, maybe you've just improved your thyroid function, and because it's working so damn well, you don't need as much of it. I don't know. I think it's a possibility, because what we see is, even though we see a reduction in free T3, what's supposed to happen if it's truly hypothyroidism is
Right.
that the TSH will go up. And I don't see that. I might
Right.
see a TSH of, I don't know, 2.8 or something like that, but it's never over 5, never.
Right.
And like I said, and they don't have symptoms. So definitely we have to interpret labs based on, kind of the nutrition state of the patient. And that goes for cholesterol and all sorts of other things. But certainly any sort of calorie restrictive diet will affect thyroid. And when we look at hypothyroidism in women, there's really two reasons. Um, iodine deficiency and excessive iodine. I've seen a lot of
Ah.
people in the space that are just like putting the iodine drops and all their
It's a
stuff.
big thing right now. Everyone's talking about it and just
Not
like
good.
telling
It's
everyone
not
to
good.
supplement.
Especially
Yeah.
if especially in face of a selenium deficiency. And so
Yes.
especially so in Hashimoto's, you don't want to give iodine, especially in a selenium deficiency. And so you got to be careful with the iodine supplementation. And for women in particular, because a lot of cosmetics have a ton of iodine in them. So
Ah,
I don't buy the fact that a lot of women are really truly iodine deficient, but something to consider. But Hashimoto's is the other one, when people create antibodies. And I think that starts in the gut. I think that starts in the
mhm.
gut. So I think that, a lot of people will suggest a gluten-free, dairy-free diet, but I think ketogenic diets, that are devoid of those things are a great place to start for Hashimoto's too, just because if you're truly in ketosis, you get this anti-inflammatory effect through the NLRP3 inflammasome. So, but yeah, I mean, these are great things to talk about for women, and get your numbers checked, and get them checked a couple times a year if you're having trouble, or once a year if you're not.
What do you think of the iodine patch test to find out if you're iodine deficient or not? Is that accurate, or would there be some other way to tell if you truly were iodine deficient?
Yeah, you can check urinary iodine. I mean, you can check, iodine levels. I think that's like a cheap, we always say like cheap and dirty test. Like it's like,
Mhm.
it's probably not perfect, but maybe, I don't know. I don't suggest that patients do it, but I start with the thyroid labs, and then if we have to go down the rabbit hole of looking at iodine, then we do. So
Gotcha. Cool. Well, this has been awesome. I know I could keep talking for at least another hour, but I know you are busy and have a house full of kids and getting ready for Mrs. America. So I really want to thank you for all your time today. And I know that these are some really important topics that just are being talked about a lot in the keto and carnivore space, which I'm blessed to be a part of. But I like to add a little bit of a different flavor, I think, than, than what people are saying. My new slogan is meat based but dogma free, and I'm just trying to help people find out what works best for them and to not get so caught up in just fitting into a box. So
I
I
love it.
appreciate everything. Yeah, yeah. So thank you for everything today. And where can people find you if they want to follow you, if they're not already following you?
Yeah, you can find me on social media, both Facebook and Instagram, Dr. Fit and Fabulous. And then my website is drfitandfabulous.com. I've got a YouTube channel. I'll be posting daily updates from Mrs. America. So if people want to follow along on that journey, it is going to be live streamed. It'll be a
Oh,
paid live stream, and I don't have the details yet for that. But for anybody anywhere in the world, if you want to tune in, it's March 27th. It will be Las Vegas time zone. So for my poor Nebraska friends, you're going to have to stay up late.
yeah. And here I'm in Atlanta too. So on the East
Yeah,
Coast,
you
even
too.
later for sure. Yeah.
Take a nap.
Awesome.
Take
Well,
a nap.
so much fun to talk with you. And thanks again for coming on today.
Thanks, Sarah.